Hello everyone and welcome. I'd like to begin by acknowledging the traditional owners of the land we're broadcasting from tonight. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. Welcome to another instalment of the Future Forum, where we tackle major global challenges with a panel of experts. I'm Tegan Taylor, I'm a journalist with the ABC Science Unit, and I'm your host and moderator for this series. I'm also an alum of the University of Queensland, which, by the way, is celebrating its 70th year of awarding PhDs this year, an impressive milestone in UQ's proud tradition of intellectual inquiry. And speaking of intellectual inquiry, I'm looking forward to getting stuck into tonight's topic, the health data revolution. With our panel, we'll be exploring how digitisation and technology are transforming the world of health. Before I introduce them, a reminder that this is your forum to ask questions and be part of this discussion. Thank you so much to those of you who submitted some terrific questions in advance. Make sure you use the Q&A button on your screen to send in questions as we go tonight. I'll get to as many of them as we can during the discussion and part of the Q&A at the end. So joining me on the panel tonight are Adjunct Professor Robin Littlewood, who's the CEO of Health and Wellbeing Queensland and a paediatric dietitian. Dr. Melissa Naidu, who's a non-executive director and strategic medical advisor and clinical reference lead for the Australian Digital Health Agency. She's also the founder of Women in Medicine and a member of the UQ Senate. Associate Professor Claire Sullivan, the head of the UQ Digital Health Research Network in the Centre for Health Services Research, and Dr. Idis Wong, Data Strategy Lead for Queensland Health and a researcher in data science, health systems and policies. I am not at all intimidated by the brains joining me here tonight. Professor Keith McNeil was originally going to be joining us as well, but he unfortunately wasn't able to be here. So Claire, let's start with a quick definition. What are we talking about when we're talking about the digital health revolution?
So healthcare really is all about information and decisions. And since the very start of time, when Hippocrates sat under the tree and got the information together and made a decision, clinical care has been all around information and decision making. And that hasn't changed thousands of years later. I think what has changed is the amount of information that we're being asked to consider every time we make a clinical decision. So previously, perhaps there was a few items of information that we needed from our consumer. Now we're confronted with electronic medical records, wearables, sensors, and so the whole way of making decisions in medicine is changing. And so digital health is really about how do we do that in a way that creates a great experience for the consumer and the clinician? How do we use that data, not just for that single interaction, but in a way that improves the system? And thirdly, how do we use the digital workflow and the data to create new models of care and new ways of caring for people that perhaps allows us to relieve some of the ambulance ramping and create new ways of providing better healthcare for our population?
So there's a lot of stakeholders in this situation. Idis, can you talk to us about how to get people on board with understanding the value of data?
Yeah, getting them on board, it's so important to understand the value of data because you've got different stakeholders, right? You've got consumers, they need to understand, data, how do we improve health outcomes and their health experience for them? You've got clinicians, I think getting them on board too, how to use the data, but also understand how to use the data in a way that fits with their practices as well. And then you've got your system administrators, understanding there's a lot of data out there. So what kind of data we want and what kind of system kind of outcome we want using that data.
And that's something you're working on, Robin, that partnerships of bringing people together to share that data and use it in ways that are actually useful.
Partnerships are just so important. We have been through so much. So whether it be through the COVID thing, the last years, whether it be through floods, so many things. And so we've got to think about the future differently. And so we've got to work with our partners as well. It is so important to bring in government, to bring in university, to bring in the privates, to bring in everybody so that we can work on this together. And data is exactly the same as that. So for us, the most important thing is to work together and to bring in the skills that people are most most good at, if that's a word, that's very, I'm from the University of Queensland, I'm terribly sorry, that people are very, very good at, and then bringing them together and bringing those great big brains in together to make the right decision for the right communities at the right time. And that's exactly why we need to partner and truly trust each other.
But at the centre of this sits the patient. Melissa, what does patient-centred care actually mean, and how is it sort of happening in this context?
Wow, I think, look, patient-centred care I think is a word or a concept that we bandy around a lot. I'm not sure that we necessarily do it all that well. What it really means is about putting the patient or the consumer or the user at the very centre of what we do. And I don't think we do that. We talk a lot about it, but still in health, everything is driven, I guess, by the clinical workflows, the systems that are currently in place. And we need to kind of almost dismantle those in order to be able to make things truly patient-centred. I think data, and I absolutely agree with what Robin was saying, I think it's about partnerships and getting data. Data is just data. It's about the type of data that we collect, the purpose for it, which is, you know, influences how we collect it and the data we use as well, because otherwise it's meaningless, and how we structure and organise that so that it can be meaningful and used in a way that can benefit others. So when we talk about data and patient-centred care or consumer-centred care, person-centred care, I think it's really about amassing data in a way that actually benefits the care of patients from what they need and what they want, allows us to deliver better quality care, solutions to things that we haven't been able to do before. But it's really important that that data is highly representative, because if it's only for a small proportion of the community, then we're not going to see the outcomes, and we're going to continue the inequities that already exist in health.
I think whenever we're hearing big data bandied around, there's inherent kind of suspicion of that, and I do want to get to that in a bit, but first I'd really love to focus on what it can look like when it's working well. So Claire, what are some examples of, for the patient, the payoff that happens when we've got big data working at its best?
So I think Drucker taught us that what is measured matters.
You're really going deep into history tonight.
I'm going deep into history here. But that's true. So what is measured matters. So from a consumer perspective, around your healthcare, if the only thing that's being measured is how much time you're taking or the billing, we're missing a lot. So I think there's a challenge for us to start to look at other facets and measuring them. So not just counting how many episodes of care we do, but what was the experience like for that consumer? What were the healthcare outcomes like for that consumer? And what was the experience for the clinician providing the care? So the quadruple aim of healthcare. And I think by having a really strategic approach to our data across those 4 quadrants, we start to build up a really nice holistic picture of what an episode of care might look like. At the moment, we're not measuring them particularly well. But if we start to measure all of those, you can imagine that the consumer is going to have a much better experience, outcome, and hopefully the system will become more efficient. So I see what measures matters. So unless we're actually measuring things, they're not going to matter to the funders, they're not going to matter to society. So in my view, the data allows us to make things matter.
But it's not just about the patient experience in the healthcare setting, it's also about the data that can be used to, that aggregated data can be used to help with treatments or...
Oh, absolutely. So a part of the reuse of that data is to start to evolve our thinking. So when I talk about data and analytics, I guess the descriptive analytics is what is happening now, and we're doing that. Predictive analytics is starting to use those analytics to predict what might happen next. And you can imagine as a consumer, if I could predict that you've got a 20% chance of developing a condition and this is what you can do to stop it, that's immensely valuable. And then thirdly, prescriptive analytics. This is exactly what we need to do right now to stop that adverse event happening. So that continuum of analytics is dependent upon data. Yeah. But you can see the benefits to society, I think, for shifting from our current break-fix model to predict-prevent means that we're likely to circumvent a lot of human suffering.
That's a question that we've had from some of the audience, and I will come back to that. But Melissa and Robin, what about at the systems level or the big picture, like the state level for Queensland, what the opportunities are if we're doing this right?
Do you want me to start with that one? I might start first and just say right now there's a great big shift and everybody's starting to work together exceptionally well. So before we were so good at doing things on our own and that's it, but it's bringing it together again. So whether it be across government, whether it be across both us and universities, and we've been doing that well. So with the Department of Health, we've now been working exceptionally well and in true partnership as well. And so there's trust. So that to me is the way that we've got to look at the future as well. And so we've got this so right now. So let's go. And the data piece helps with that, and it just tells a beautiful story around that. So yes,
I think absolutely. I think what we've seen through the pandemic is that our system, which is so siloed and fragmented, could never have dealt with a problem like what we've had unless they worked together. And it was only in working together and across all of those silos and the fragments of our system together that we've been able to tackle those problems. And I think that now that we're seeing the power of what working together, sharing information across those silos in a responsible and a trustworthy way can really make a huge difference to the health of people. And I think the missing other piece in that is around consumers and being part of that, and partnering with government, partnering with organisations and harnessing and taking control and responsibility over their own information as well, and responsibility for their own health and wanting to be active. So I think health literacy then becomes a big part of that, is how do we empower people to take action for their own health, to share their data so that they can be healthier individually, and as you said, sort of very metric focused, a lot of the data that we've gotten, but also collectively as a population, how do we move everyone up so that they can reach their full health and wellbeing potential? And I think that should be really the aim of what we're trying to do here and how we use data to progress that aim.
Empowerment is just the most important thing. The more that everybody learns, and they can then make these really, really good informed decisions. I love that. So let's just empower everybody to do this, including clinicians.
Yeah, and I think when we talk about trust and partnership, it's as if we're giving something away. But whenever I partner with you, with university, I learn something new. I learn a new perspective in the work that I do. And I think we need to extend that trust and partnership to include consumer as part of that conversation as well.
Absolutely.
And that anchors on data, because without data, there's no meaningful way to engage consumer to advocate for their own healthcare.
The data tells a beautiful story around that as well. That's what I love about it.
You mentioned data as a tool for consumers to advocate for their own healthcare. Can you talk to that a bit more?
I think we've seen it in other industries, right? In credit card statements, in power bills. we probably have. Yeah. And that's such a powerful way. And also providing that data, not just data, but in a way that people can understand, in a way that resonate with people. Then people can ask questions. People can reach out to their banks and say, hey, this doesn't make sense. What am I doing wrong? How can I take responsibility for my own finances? And I think we can definitely do that in health, and we should.
That's right. It's our job to do that.
Yeah.
I think that's the missing piece of the trust aspect as well, because there is a lot of mistrust, I guess, or distrust about data and how it will be used. And that's based, I think, on history as well. And I think, health, medicine has to move away from this paternalistic aspect. If we really want to build trust, then you have to give over some power and say, how do we actually help people to understand? How do we educate them? How do we give them the tools to be able to interpret and take responsibility? And then they would be more likely to share the information that we need to make the gains, going forward in health.
Yeah, you mentioned empowering people before, Robin, and I wondered what that looks like to you.
Education, the most important thing. So don't task anybody to do things, so ensure that they know the reason why that this is being used. So curriculum, graduates, thinking about every single part of the system, because that's where we get them. Right there, it's great. So training, and just so that we've got that, so everybody knows the reason behind this.
Right, so you're talking about all through the layers of health providers
Yes.
But then what about patients as well?
Patients as well, though.
I think
so
it's
too.
about
So
inclusion, and I think it also goes to lived experience. So it's having people who have got lived experience in decision-making roles, in information, in roles where they are informing, policy and the way things are being done. And so I think the more that we create opportunities for consumers, for clinicians, for everyone along the healthcare journey to be involved, that's how we actually get a system or a process, I guess, whereby we actually get the best outcomes and we empower people, really.
Because you want to make the point out is that data it's not static. It's coming through a system that has biases built into it, whether we'd like to think that they're there or not.
Yeah, definitely. I think data is not inert, it's not a neutral property. When we look at data, we apply certain accents based on our own experiences and our own thinking. So it's really important we make sure everyone is at a table looking at the data so they can ask different questions that I haven't thought about. And so we're not presenting this kind of sanitized view of what I think the world should look like. Robin and Claire and Melissa should be able to say, hey, from my experience, actually I have a completely different interpretation of that. And both interpretations are true.
This actually talks to a question that Chelsea sent through before the session saying, what can we do so that increasing digitisation and data sharing doesn't further multiply and distribute discrimination and abuse against people who are already marginalised? What are some of the safeguards that we can put in place?
I think that goes back to the inclusion. I think historical data is already inherently biased, and a lot of, the charts and the normal distributions that we work off in health and in medicine are actually only based on small populations. I've got an unclassified variant on my BRCA gene. Is that because I'm of Indian descent, or is it truly meaningful? I don't know, because the populations that was studied in aren't representative of me. And when we look at, children and growth percentiles,
CDC
again,
growth charts,
it's absolutely not representative of everyone. So those things exist, and I guess that's the power now of the ability to collect large amounts of data and structure it, is that we have the opportunity to be more representative, to include everyone. But I think it only happens with paying attention and mind to the fact that if we don't do that deliberately and ensure that everyone from, and I know I just be interested in this, everyone from the ground up, building it, being involved in the design, the collection, all of that, as well as the patients themselves, are representative of everyone, and we know whose voices aren't there and who's not represented, and we correct for that and do that as an active process. I think that's the only way that you ensure that you don't further widen the gap, I guess, and see that disproportionate impact on those people who are already vulnerable, marginalised or underrepresented.
For me, it's about thinking about those that fall through the cracks as well, and the data helps you find them. For me, it helps rather than anything else, and because this state is so incredibly vast, then it gives others access to things that before they didn't have it too. So things that they could do before. Things that they couldn't do before can now, and I just love that as well. So thinking about those right up in the far north at the moment, where life expectancy is 30 years different there between those and those in those in southeast Queensland. That is just not fair. The data can absolutely help with that.
Are there some success stories that you've sort of seen in your career in recent years of this is why we're doing this?
I'm happy to take that one. So we have. So we particularly have looked at the correlation between things like stays in emergency department and mortality. So a study that we did here looked at 16 million emergency department episodes and then correlated that with your risk of death. And what we showed is that the longer you waited in an emergency department, the greater your chance of an adverse outcome when you're admitted to hospital. And that work resulted in changes to emergency care targets here in Queensland, nationally and internationally. And so that was an absolute, example of how looking at adverse outcomes from our consumers and correlating that with measures has shown a system improvement. So yeah, I do think we now have examples where we can talk about it.
I mean, everyone wants to benefit from that, right? Or people want to know if they're getting screened for a breast cancer gene, that's going to come up. But at an individual level, perhaps we're hesitant to want to share that data. Where does that hesitation come from, do you think?
I think sometimes it's also, not understanding the data pipeline. Where does it go? What's data? What's the risks? And we don't have these conversations enough. And I think not being able to see the benefits of those data is part of that as well, because we're always thinking about risk, but what about the benefits? We see that in other sector, and I think we need to talk about those as well.
I think that you remember the great big things that went wrong as well, and so you know that there's a lot of those, especially in America, and you think about those and you think, oh, that can never happen here. That's really, really tough for us. So we've got to be so careful here. So dispelling myths here is essential now, and that's where I think that we've got to go, because anyone that you speak to knows about them, because they go everywhere. Everybody remembers.
People love bad news. What are some of the myths? What are some of the myths that can be dispelled? Because that's like one side of it is like, that's not true, that's not going to happen here, and the other side of it is, what precautions do we need to take to ensure it doesn't happen here? So let's start with myths.
People can find where you are, where you live. They can track you down. I've been told all of those things. Oh, yes, absolutely. And movies do that as well. You watch that and you go, wow, they've found them and they found that poor child or that, so yes.
And I think coming back to my background in social science is that things that we don't understand, we tend to anchor on dread. So nuclear power, for instance, we don't understand it. So how do we think about that? We think about those images, we think about those stories. So I think one of the ways that we really need to get to that is to help people understand, data, what is data, how we can use data, how we're using it now, and what are some of the future, benefits and opportunities we have. And I think that is the only way we can get through that conversation.
I also think we perhaps need to mature our understanding of risk. Okay. So it's easy to look at something and say, that's risky, I'm not going to do it. And if we did that about surgery, no one would ever have an operation. So I guess we don't look at a surgical operation and say, I'm never going to have that. We have the operation understanding that there is risk. And I would take the position that data is similar. That of course there's a small risk with data that something might happen, the same as when you take insulin or you have an operation. However, the benefits of sharing your data and learning from the data greatly outweigh that risk. So let's not be naive and say there's no risk. The same way there's risk with an anaesthetic or taking chemotherapy, there is a risk. But the benefits outweigh that risk. And I think we're demonstrating that now.
There's also the risk from doing nothing.
100%.
Yeah. Absolutely agree. I think it's about risk benefit, and I think also it's about understanding that and being informed. So again, it goes back to the sort of, the health literacy, the digital health literacy. I think the other thing that's really important about understanding the risk and the benefit is knowing, not just for yourself, I think, but for those around you and for the population, and understanding the differences that makes for other people, and how it can bridge divides and create greater equity as well, I think is also really important. I think people are also, I guess, the element of trust is that, our legal systems, our ethical thinking, our regulatory systems have not kept up with the pace of digital developments and health. And I think that is something that has also probably fed into people's concerns and worries about that. So I think that's something that we need to also ensure keeps up and keeps pace and is flexible enough, I guess, so as to not squash innovation, but to allow people to have some certainty and assurance about how their data and information is used, and that it won't fall into the wrong hands. And I guess people's perception of what the wrong hands might be or the wrong uses is based on things that have gone wrong in the past, but we've learnt from them and we need to continue learning from them.
And I think drawing on some market research done recently in the public about trusting government through the COVID response, I think there was actually a lot of uplift about, we have handled their data responsibly, appropriately, and we've done things with it that benefit society. So we should draw on those examples as well.
There's the risk that your data is used for foul purposes. On the flip side, there's the risk that we're collecting all this data and we do nothing with it. So can we talk about the logistics of handling massive amounts of data and how to ensure that it actually gets to use? Claire, take us away.
So this is a new area and it's a new science. And so we've established a new science, and this at University of Queensland. And I'm not sure, Tegan, when we last established a new science at University of Queensland.
Right, wow.
don't-
Not since Hippocrates.
Yeah, Hippocrates, perhaps. Maybe 70 years ago. So we are now setting up digital health at University of Queensland. That's really important because we need to establish best practice. We need to have a trusted and evidence-based way to manage data, and we need to have the capacity and capability here at the university to model that, to teach that, and to continuously improve that. And that requires resourcing, and we've been incredibly fortunate to be supported by the university to set up a whole new discipline here, and that's very exciting. And we're partnering with our wonderful colleagues at Health and Wellbeing Queensland and Queensland Health, who've also supported us, I think with the acknowledgement from all of us that this is something new and something that Queensland really has the potential, I think, to lead, to demonstrate best practice, to behave responsibly, and to show others the way. But yes, a lot of resources.
And then how does that then get implemented in hospitals? How do you get doctors and clinicians on board with, I mean, they're already busy enough.
So busy.
Yeah.
Slowly. Take it step by step. So again, it's not about making them do it. It's about teaching them why to do it. And then you start there and you go slowly with that. So it's again about graduates and getting them here, because then they are so helpful forever after that. So for me, teaching them why is the most important thing.
I think the other opportunity is also getting them at the table early to advocate what do they need, you know, rather than kind of giving them another tool. It's, well, Tegan, how could we help you? We've got all these amazing things. As a doctor, what would you like to do? I think that's really important.
How can we help you? Not the other way round.
I think it's asking the right questions and involving them, absolutely. And I think we need to do that from really early on. And that's one of the things is starting right from, you know, in our medical school training, clinical training for all our clinical disciplines, is involving, you know, and teaching them about digital health. Because, you know, once they're working and they're in the hospitals, they're so busy seeing patients and doing their day-to-day work. Often they don't understand why this is of importance to what they do on a day-to-day basis. I think there has been in the past resistance and fear of the unknown. And certainly speaking for doctors, we don't like doing things we're not good at or we don't understand or we haven't been taught very well to do. So we like working in our field of, you know, expertise. I think through the pandemic, we've actually seen that start to be overcome. We've seen the benefits. I think clinicians understand very well that digital health is something that can benefit their patients, can benefit them, can benefit our workforce from, you know, burnout and all the other issues that we have around it. The issue around resources and limited resources and using them effectively and efficiently. So there's lots of benefits. I think we also know that it's something that patients want and consumers want, and that we have to go along on the journey. But I think it's about figuring out how do we actually speak the right languages. Often people would sometimes say to me with clinical engagement, you ask doctors what they want in a digital thing and they'll give you every whiz-bang thing. But you've asked them what they want. If you ask them, what do you think your patients need? That is a different question. They will give you a very different answer because they know what their patients need, but that's not the question they've been asked in the past. And so I think we have to think about what information we want and how we extract that from our knowledgeable people who are treating patients every day.
So what kind of partnerships are involved here? What sort of stakeholders do you need to be bringing together? Because I know this is what you're doing to ensure that the solutions that you're coming up with are going to actually tick the boxes for all the different people in that pathway.
Everybody. So when you think about that, schools, the data from schools, the data from health, the data from sports, the data from everything that you can think of, and then bringing along universities, bringing along private industry as well, so that you've got a skill set here and here and here, and bringing them together to do the things that they are really, really, really good at. So, and then that governance and that trust as well. It's the most important thing. Starting there, and you can go everywhere with that, but you have to start there first of all, and just build and connect first.
Melissa?
Look, I think absolutely. I think you have to be inclusive. I think you have to think and be deliberate and pay attention to whose data may not be included or excluded. I think we have to be really mindful of the digital divide, and I think that happens on a number of levels. It's people who don't have access to internet or broadband, and so therefore can't utilise digital solutions. It's focusing only on high-end smartwatches, which a majority of people won't ever afford or use, to also focusing on solutions for the greater population who already experience good health. So we have to invest in solutions and health solutions and devices and digital solutions that target those who don't actually have access to them and can actually benefit from them most as well. And I think that's the biggest danger, is that if we don't do that, we only just focus on things that are shiny and exciting, that we will continue to actually broaden that divide.
And that's why you do bring in everybody around, that you bring in every single one of us to do this together.
Because I think the more people are involved, the more questions you're going to get asked as well.
Correct.
You know, people will say, "What about this? We haven't thought about that."
And then biased view.
yeah,
Does that also help with buy-in, getting people part of the process from the beginning?
yeah, absolutely.
So talking about the future, where we would like to see ourselves in 10, 15, 20 years' time, what does that shiny future look like, and then what do we need to do to get there?
I think Claire's got the answer to that.
I don't know that I have the answer for that.
holds all the answers.
But in 10 or 20 years, I hope as a doctor I'm out of a job. That would be perfect.
The
because
dream.
What I'd like to see is I'd love to see Queensland as a learning healthcare system, or a learning health system, where we understand everybody's risk using data, and we intervene early, and we learn, and we stop people getting sick, and we keep learning so the next generation has better and better outcomes. We close the gaps that Robin's describing, and we keep learning. The amount of intelligence that we have in the data should allow us to become smarter and more precise with the medicine that we deliver. At the moment, the chemotherapy you receive may likely have been developed on a trial of 50 white men, for example. By using all of the data that we have, we can start to precisely target chemotherapy to your exact genetic makeup. And to me, that's just so exciting, and will deliver better outcomes for us all. So I would love to see us as a learning health system. Yeah, that's what I hope.
Yeah, I absolutely agree. I hope in the future that, my children and those around me, when they have treatments, that they're targeted towards them and that they don't get the side effects or the ill effects of them. I think that would absolutely be wonderful. I'm not sure I want to be working in 20 years' time, but if I was, I think that healthcare is human, and so I think we still need, no matter how much data, how many digital solutions we've got, it is a human endeavour. As human clinicians, we want to have human connection, and we do well in that, but patients and consumers want that as well, and that's what we've seen through the pandemic, is that there is that need to have human contact, and I think that digital health, digital tools and solutions are an enabler, so that we, clinicians, can work at the top of our scope, can actually do the things that we do best, and can help harness all that wonderful information that is too much for our brains to be able to process, but to give people the absolute best quality outcomes that they can have. And of course, ensure that that's actually the same for everyone, regardless.
I've got 3.
Okay.
So I want my adult children to have moved out by 20 years. So that's my number. That's my number 1. My number 2 is that everybody gets what they need as well, and that we can find them. Number 3 is that we all stop talking about MOUs and safety and risk and things, and talk about the work. Talk about the work and the things that we actually need, not the, and have we signed that, and then it goes back and forth and things as well, and trust will always get you there.
Yeah. think for me it's really simple. It's just consumer having that data in front of them that they can ask questions easily, and understanding that health outcomes means different things for different people. So, you know, I can advocate that, yeah, sure, that might be important, but that's not important for me right now. So I'm not going to work on that, but let's talk about it in 2 weeks' time. And I think consumers should have that opportunity.
That's great. You mentioned having what people need and actually being able to find them, and that sort of was something I wanted to bring up about equity of access. Like, we have the ability to have really highly personalised medicine, and that's fantastic if you're one of the people that gets it. And how to ensure that that accessibility is there for anyone.
So we need to invest. There's no doubt about it. And, you know, Robin's highlighted some of the inequities we're seeing. But when you look at where digital health investments have gone, they've largely gone into quaternary acute care settings.
What does that mean?
So big hospitals.
Right.
In cities.
In cities. And there's electronic medical records and sophisticated capability there. That same sort of technology isn't necessarily everywhere. There's a wonderful investment at the moment with a plan to roll that out, which I think is fantastic. So we need to put that basic infrastructure in everywhere, the same way we put water, electricity, Wi-Fi. This is on Maslow's hierarchy of needs now, just making sure that we can deliver it, because it's not fair if we have inequities across Queensland in terms of technology. And I think that we are getting towards reducing that, which is wonderful.
It's not fair.
I think it's equity of access, but it's also, equity in terms of outcomes from a safety and quality perspective. And we were just talking before around, even between one hospital and the next, there might not be electronic medical records or decision support in place, which creates, safety differences for patients in those two hospitals. And so I think thinking about how everyone can benefit, let alone when you superimpose regional differences and ethnic and other variations on top of that as well.
Queensland's doing it though at the moment. We're just going so well, and I just look at the team here, and I think we are doing this so well right now, whether it be government, university, Department of Health, Queensland Health and Wellbeing Queensland. We're just doing it together. We just did it, and then they came. Build it and they will come, and that's exactly the things that we've been doing, and Claire's led that. That's just been amazing to do this, but we can become the leader here, and we absolutely are, and I love that.
I think in terms of other states, Queensland is leading. We have a very large single electronic medical record across over 60% of all public health care. That's just remarkable, and so I'm very proud of it.
So you should be. Group high five. No, but, so Queensland, it's fantastic. We want Queensland to be really, really great. What about the nation? Like, how does this scale? Is the talk about a Centre for Disease Control part of this? How to make sure that this is equitably distributed across Australia?
So maybe Melissa.
Yeah.
Oh, that was for me. I'm responsible for Australia.
Queensland. I have my borders.
I think we need to export these people, clearly, share them with the rest of the nation. Oh, look, I think it's about taking what we're doing now and sharing it. I think it's about collaboration and collegiality. Clearly, we live in a country which is federated, and there are differences in how the health system has run, but I think there is certainly the precedent, I guess, at least, even though we've all dealt with the pandemic in different ways, we've had to come together as a nation as well. And I think it's about having a national health and national digital health strategy, and ensuring that we're actually tackling those things on the label. So that's the other thing, is we shouldn't be having inequities and disparities between states either.
Not in this state. Not in this age, not at this time, absolutely not.
And I think one way is really important, that we always talk about digital health as a distinct discipline from health. So you see documents that talk about different areas, different impacts of health, and then digital. And I think we need to get away from that, because digital is not just its own silo.
That's another thing I'm hoping to sack myself from, is digital health just becomes health.
Yeah.
Why is there that divide, do you think?
I think it's because people have different disciplines, right? We're quite used to kind of going, people have different disciplines. You've got your social science, you've got, your clinical sciences, you've got your tech digital people over there. And I think we live in a world now where digital isn't its own discipline anymore. It's so amorphous.
We work at home now too. We work at home, so now we just can't call the tech person anymore. It's you or your 21-year-old. You know, could you come and help me with that? We've got to be so much better at that. Yeah.
Speaking of digital questions and being asked, please use the Q&A to submit your questions to this amazing panel. Ask them all your questions about digital tech. One question that was submitted earlier was from Wen Choyan, who asks, can we use tech or data to assist patients to find the best doctor for diagnosis or the best surgeon for surgery?
Oh, we definitely have that already. We've got different dashboards, and one of the things is that we've got dashboards looking at patient outcomes and safety outcomes, comparing across different health services. And I think we need to do much more of that so it's more accessible to consumers.
And then another question from John, sort of asking about Queensland Health on one hand and then private health providers on the other hand, and how they're working together to pull this data.
Well, look, I can't speak on behalf of all private, but I have worked in the private system and in the public system, and I think that is one of the areas where, you know, as you were saying, we've got an electronic medical record in our public health system, and that is patchy in the private system. I think that it is expensive thing to do, and that capital investment is really challenging, and I think how the private sector comes along is certainly something that we've got to look at and think about as well, particularly as we were talking before about partnerships and reducing those silos between private and public healthcare. I mean, private sector is responsible for the majority of elective surgeries and procedures, and so that is a significant amount of healthcare that is delivered through the private sector, and we should be ensuring that we're actually enabling the private sector as well to be able to deliver that care in the best way possible. But harnessing that data combined with, you know, public health data and ensuring, and I think, you know, that's always one of the fears, is that data that is owned by one organisation or one sector, how do you share that across, and how do you ensure for the integrity of that data, the quality of that data, and also preserving people's privacy is a challenge, but we've got to work through that because, you know, that's how our population works. We can't segment people out based on where their data resides.
Yeah, and I think through the pandemic, there was a really good experience as well. At one stage, we had to look into using private beds. You know, what does that look like? So we had those discussions, and we need to harness those thinking and going, well, if we were to use it, we need to look at, you know, digital and data infrastructure. How do we make sure that patients are getting
real time?
Exactly. Yes.
Which we did.
Yes,
which we did. It was excellent.
Yeah.
Can you give an example of that in action?
I don't know if that was, there was more conversation, and thank God we didn't get to the stage where we had to use in real time data of private beds of COVID patients in there. But that was a very real scenario that we looked at. Absolutely. And I think when we are looking at, you know, not the post-mortem, but COVID 2.0, that's something that we would need.
So we've got questions coming in. You can continue to submit yours using the live Q&A box. Just smash that Q&A button. But Annette's asking, the government's My Health Record promised sharing of health data to improve patient care, but in practice, very few medical practitioners upload information to My Healthcare Record. Why? And how can it be made to be used as it was intended?
Look, I don't know the stats off the top of my head, but it's certainly something that is increasing. So I think that organisations, I think it's over 80% of practices, hospitals now upload data into the My Health Record. Don't quote me on that. I didn't memorise them before I came today. I think the My Health Record has certainly increased and uplifted in the use. And I think it's all been a journey, as we were sort of talking about before, around that information becoming more usable, more accessible and more meaningful. And I think it's one of those things where you get to a bit of a tipping point. Once you've got more and more data, you've got it accessible and more people using it, it becomes more useful as well. And those early adopters then convert into everybody becoming an adopter of it. I think there are some challenges again with, you know, private hospitals, the public sector, private sector and other organisations. But I think that is something that's going to continue to move. And I certainly, through my work, you know, liaising, I provide some clinical reference input into the Digital Health Agency, and I think that the work that they're doing and trying to make that really meaningful for both consumers and for clinicians and for providers. Things like having your COVID vaccination results. I know recently there was just an update around influenza vaccination. I know I accessed my child's immunisation when I had to go visit my grandma in aged care home. The easiest thing I could do was to download all of our vaccination results so that we could go in. I think once people start seeing the usability of it and increasing trust, and I think that opt-in, opt-out has helped to build that, that we will see that continue to increase.
I've had a couple of questions from people asking about preventative care. So Spyro and Yilin are both sort of asking around, in big data, is there a game changer for early detection or preventative medicine?
Iris and I are working on that at the moment, aren't we?
Robin, would you like to talk more about that?
Iris and I are looking at that right now between us and thinking about the things that we can predict risk as well. So yes, but again, it's the training as well, the use of that, and making sure that we can then give the right advice around that. So yes, and giving them tailored advice around that as well, which has now become so much better.
And I love that question, because now we're not thinking about health as this kind of pocket. We're acknowledging that health doesn't happen in a social vacuum. So I think just by the fact that we have this question and the fact that we have been doing something on this,
absolutely,
it's just moved beyond.
And we're not waiting until we get sick anymore. Exactly. We're thinking about the things that we can do with health, not sick, which is great. So yes, absolutely, and that's got to be the way of the future as well for us.
But it is all predicated on people actually being able to access health care. You know, they've got to still be able to talk to someone. There's got to be a starting point with the medical system that's still got to be resourced in a way that is useful, and that's really patchy across the state as well.
But it doesn't need to be boring as well. Do you know how now you look at a fact sheet and you go, oh, I've got to look at that, and I can't do this, and I can't drink anything, and I can't eat anything, and I've got to eat my veggies, and I've got to do this. But now there's gamification and stuff as well that you can do to make it fun, and that's what that can bring, especially for kids as well. So now they can do their own cares as well, because now they get that through their phones.
I think that's absolutely, it's more than just healthcare, it's about healthy behaviours and lifestyle, and I think that's the problem with when we look at healthcare, we're looking at the other end of the spectrum where it's actually the behaviours that people have had largely in the 10, 20 years before that, that have influenced where they are, including the length of their health journey and the treatments they've had or haven't had during that time. So I think, a lot of what people often think of as digital health might be the lifestyle and health apps that kind of nudge behaviour in a positive direction and educate. But I think what we'd really like to see is that increasing use of clinically vetted, I guess, and clinically proven digital health that can actually make a difference to people's outcomes.
But that can be fun as well. Yes. It can be fun as well, and it needs to be so that people actually want to use it. So it's what they need, but it's what they want as well.
I think people are using, certainly the evidence through the pandemic has been that the use of digital solutions to provide things like mental health care, to provide immediate care, triaging, advice, all of those things has certainly gone up, and they have been increasingly utilised by those who would potentially have greater barriers or be less likely to access traditional care as well. So there are some markers, I think, that this could be a really positive thing for our society.
I think in mental health care, I think it was increased by 80% at that time, which is just enormous and proves, again, that it absolutely works.
And I think it's about making it personable for people as well. We're not, like Robin said, we're not just giving fact sheets to people, we're not just giving
all of those days, thank goodness.
It's about providing information to you that is personally relevant, that you can action upon. And I think that's the powerful thing.
What they need, and it's what they want as well. And so that's what the data wants. That's what the data does.
So by knowing things about people, you can tailor it, and it feels it's tailored and it's personalised for them. So Karen is asking about training the next generation of clinicians to really understand the power of data and how to do that. The look on your face says that's a challenge.
We've started that, Claire.
that.
Listen to me saying we. Claire, what are you doing?
Well, actually, you did start it. So.
We did. Yes, I did, because I couldn't do it at the beginning, and I wanted to do it, and I was just a dietitian, I've got to say. And so for us to go and get some money and then get the people that can actually do it was the most important thing for us. And when I say just, I mean I was a dietitian. I'm very proud of that.
So look, yes, we acknowledge that that is a gap at the moment, and we have a grant funded by the Digital Health CRC, secured by my good friend Robin Littlewood there, which has allowed us to set up a graduate certificate in digital health and clinical informatics at University of Queensland. So this allows us to actually create that curriculum. We've then taken portions of that and put it into undergraduate degrees. So we're now reworking some of that for undergraduate medicine, you'll be pleased to hear, so that not training how to use an IT system, but education around why it's important will start to go into those undergraduate degrees. Then we've got the graduate certificate, and that's now being used as part of a national effort to create a fellowship in digital health. So we are getting there. It has been tough, I must say, but there is, I think, an understanding that this is not just an IT system that you get trained on when you hit the hospital. Understanding digital health is a really important facet of healthcare now, and we all need to understand it and why it's important.
Well, that will be welcome news to Christopher, who's asking, as a senior hospital clinician, what options are available for one to enter, study or engage in data analytics?
So graduate certificate, we also partner with our good friends at Queensland Health, and we have some digital health PhD scholarships. Also, Robin's involved in that, and those scholarships, we're advertising them later on this year, and they're quite, I think, important scholarships, because it's a partnership between the government and university, recognising that we need to have a cohort of people skilled in digital health. So that's another option, I'd say, graduate certificate or PhD.
And just to add to what Claire was saying, I think, it's really important for clinicians to be across this and to be able to use the systems to help have input into the design of them going forward, and be able to, use and harvest that data. But I think clinicians are also really important trusted sources for consumers and patients. Yeah. And in the future, now and into the future, clinicians are going to have to take patients along on this journey, and they will be an important part of digital health literacy for patients as well. Right. And so I think that's the other thing that we need to really ensure that we're incorporating into our education and training of clinicians going forward.
In some of the big hospitals in America now, as part of your outpatients appointment, you get a prescription for a drug. You might be referred to Allied Health, but you also get a prescription for an app.
Right.
And then so you go to the pharmacy and you get your drugs dispensed, but then you go to the app bar, where there's a very smart person who loads the app onto your phone, sets you up. I mean, Tegan would have two people to help you load it onto your phone. but then
I couldn't figure out how to unlock the iPad.
But then that actually becomes part of your treatment regime, just the same as your medications, your Allied Health referral and your app. And I think that level of prescribing apps is coming to Queensland.
Social prescribing is absolutely the way of the future.
And then, we can't just prescribe away, we need the support to set people up. But I would love to see an app bar in Queensland, so that you've prescribed an app and you go down and it's set up on your phone and away you go.
What app bar makes it sound like you're going to go to a bar and have appetizers? What's on the app? Like social prescribing, I've heard you get prescribed dance classes or, walking group.
Exactly that. Exactly
Right.
that. Whether you want to cook, whether you want to have a recipe, whether you want to get whether you want to go to a Queensland Country Women's Association, whether you want, so things like that can just help, but suits you as well. So everybody doesn't want to run. Everybody might, someone might want to dance, or somebody might want to cook bread. These are the things that make us different, and that's exactly why we've got to have the data, so that we've got a choice around that as well.
And I think it also kind of putting responsibility to the consumer as well, being very active in their own health behaviours. And I have accountability in my health, and I can choose behaviours that work for me. It's not just a passive passenger anymore, and I think that's really great.
Right, so you're an active participant in your own health rather than health kind of happening.
Active driver even.
And empowering.
Yeah.
And we're never going to have enough endocrinologists to see everybody with diabetes every 3 months. So the apps can actually empower people to manage it themselves, and I think that type of empowerment with chronic disease is really important. So I think it's exciting.
So one of the frequent questions that we got, it makes a lot of sense. We're talking about big data. People are worried about that sort of thing. We had quite a few questions about people talking about the sale of data, their sale of their personal data. And one of those people is Kate, who says one of the biggest barriers to trust building with data sharing is the view that some private companies are only out to profit from people's data. What do you say to this fear?
So I can only give a personal view in that I'm against productisation of data. So
that's not to say that it can't happen.
It is not to say that it can't happen. I guess this is just my personal view, is that I don't think we have social licence to sell people's data at the moment. So it's not part of the lexicon of data sharing in Queensland at the moment. I don't know how that will evolve in the future, but I think that there is trust issues if they're giving their data to somebody and then it's being sold. We have really smart ways now to synthesise data. So we're working on a project where rather than using patient data or consumer data, we're creating synthetic data sets where you actually look at the distribution of things such as blood glucose in the data set, and then you recreate that in a completely synthetic data set that's separate from any human.
So modelling kind of thing.
Well, you actually create a data set. So you use the I won't get too technical, but you create a data set on completely artificial patients that has a lot of values in there that can inform efforts such as artificial intelligence, but without the ethical implications of using real patient data. And we are getting smarter and smarter at synthetic sets. We're also getting smarter and smarter at federated learning. And that's where the data doesn't go anywhere at all. And rather than trying to bring everyone's data in to analyse it, we send code to the set. Right, so the set stays where it is and the data stays where it is. We have your permission to send a little bit of code in to do a little bit of learning around your data, and then that learning comes back, but no data.
See, I feel better hearing that from you, and people don't hear that. For me, I feel more informed about that and feel that I can support the data sharing. I've learned this from you. I was good at getting the money with Professor Andrew Burton-Jones. And then I sense of relief when you came along and we knew that you could then do that. But yes, that is exactly the reason why you are here, Claire.
Well, I'm not sure, but I do think, thanks for your support, but that those type of efforts should make people like Kate feel calmer, because we're getting smart now. We're not as primitive as let's sell our data. Let's do something smart, right? And that's what this is all about, is being smart around it and minimising any burden or anxiety on our consumers.
But I think clinicians have got to know that too. Clinicians have got to know what you've just said too. Sorry, Itis.
So I think we could only arrive at that solution if we have the trust and partnerships to have those conversations. And I think that's...
we're not just talking MOUs all the time.
Yeah, because we're much smarter than
real
that
people.
now.
We're much smarter than that now. We do.
Yeah.
We are nearly out of time, so I thought we could end on a high. Jade's asking about what role could self-sovereign identity and individual data ownership play in the new health revolution, or just where's the biggest opportunities for the future here? We'll start with you, Robin.
Access and equity for those who need it the most. So getting to those that always fall through the cracks for me, and just closing the gap, and the data that we can use so that we can find them and that we can then provide those with what they need. Most important thing, and I could retire then, but I won't until then.
Please don't.
No,
stay.
I think for me, it's about reducing inequities and ensuring that everyone can get good, high quality care, but also preserving that we're able to deliver care into the future and that we're financially responsible about that. I think in addition to the sort of, reducing those sort of health disparities, it's also about reducing the amount of harm that is done by the sort of, big hammer approach to medicine sometimes, for example, chemotherapy, where we leave people with the sequelae of all of this treatment that we do to them. And so being able to actually cure or treat disease without causing harm at the same time, I think would be an amazing thing.
I would love us to shift from set and forget. which is where we are right now. So we do a trial, we translate that into practice maybe after 7 years, and sometimes we don't go back and revisit that treatment for another 7 years. By creating a learning health system, we are constantly measuring the outcomes and constantly learning and constantly getting better. That's success for me.
Yeah. I think it's really putting consumer, empowering them with the data that they own, and because they are the agent that traverse through not just health services but social services as well. So I think that's really important.
Well, we're going to have to leave it there for tonight. Thank you so much to our panellists, Robin, Idas, Melissa and Claire. I look forward to seeing you next time. Until then, you can catch recordings of all the Frontier Forum events on the series website. Thank you for joining us and good night.